Hi, everyone. Welcome today to our Take 10 with the Family Caregivers Center. Today, we're going to be talking to Paula Bergmeyer. Paula is a volunteer with the Family Caregivers Center and a retired social worker. And today, our topic is when is it time to consider moving into a facility? So, Paula is going to talk about a variety of things, including common reasons people make that decision. So, I'm going to turn it over to Paula.
Okay, thank you, Abby. I feel like I've been given a really tough challenge here because when is it time to consider a facility placement is not a question any of us really want to answer. We don't want to think about the fact that we may need that or somebody that we love may need a facility. Not because facilities are bad by any means, we need them. And certainly we have been inundated with pictures and scenes throughout the pandemic of the difficulties that the facilities have been going through during this crazy last year, and what has been so hard to be separated from people as we all are at home or in the facilities. We could not exist without our healthcare system, and that includes our long-term care facilities. So I want to talk about when it's time for you, for yourself, for your loved one, for your family member. We all have different situations as to who might be making this decision. So you may be making it for yourself, you may be making it for a loved one, you might be making it for a parent, a sibling, a friend, somebody you've agreed to be the healthcare power of attorney, many different ways that you might be considering this. But what I want to, if you take anything away from my little presentation, I want you to hear that there is no one answer. There is no one right answer. And the answer is truly what's going to work in your situation or your loved one's situation. You have to consider so many factors that we're going to talk about now, but it's really a decision that you have to look at and take some of that emotion out and say, what do we truly need here to get the right care to the person at the time that they need it? And that's what it's all about, making sure that our loved one or ourselves are taken care of in the best possible way. That's the answer to when is it time to consider a facility placement. When are you looking at what I should be thinking about with my loved one's health, with my loved one's chronic condition, possibly a new condition? What if we're just talking about financial planning? You know, all of those are times to be thinking about what are the different things I need to anticipate in our lives, as we all do, as we plan for the future. So I want to say, I worked in medical social work for about 38 years, and I miss it terribly, I will tell you that, because I met so many wonderful people, and that's why I'm at the Caregiver Center, because I've continued to meet so many wonderful caregivers who have amazing stories. And there are amazing things that you are able to do at home to provide caregiving. And I sometimes just scratch my head and wonder, how are they doing this? They've got to be exhausted. Where did they get the energy to do all this? So first and foremost, let me say to all of you, thank you for what you're doing. The Caregiver Center is focused on you, the caregiver, though. And many times what I've seen through my years in hospital social work is the caregiver coming in, the caregiver being ill, the caregiver experiencing accident, an unforeseen illness, something happens suddenly and there's no plan for their loved one. That's tough. I can't tell you how many times we're on the phone trying to call one of their children who maybe like mine live on different coast or at least an hour and a half or so away. You just don't know what that situation is going to be. So when is it the right time to think about a facility? Right now. No matter what your situation is, right now is a good time to educate yourself and consider facility placement so that you know about it and you can think about what it would mean in your life. That's a pretty broad answer, I know. Pretty tough to think about. So what I did was I went to the research and said, okay, when do most people look at it? When do they consider a facility placement? And the common reasons that I found is really when the physical help that a person may need is beyond your ability to do that. My father was over 6 feet tall. My mother wasn't quite 5 foot. How would she be able to transfer or lift or move my father? That was a huge question when we had to make a decision for his last days. Unfortunately, he was not going to live long at this time. And so we were able to bring him home with hospice because he was going to be bedridden. And we were, as a family, able to do that. That was a situation we didn't anticipate, and 2 days before that, we thought we were looking at something totally different. So having some knowledge of what those different options might be really help you when somebody is starting to get physically to the point where you can't manage them anymore. One of the common reasons is incontinence. That's an activity of daily living that every facility looks at. How much help does somebody need? When you're looking at it from a caregiving perspective, you have to look at, can you provide those hygiene routines? Is your person, your loved one, willing to let you do that or cooperative with that? So that can have a great impact on how we feel about providing the care at home. What about those nutritional needs? What if, like me, cooking, not the best thing for me. Not wanting to do that 3 meals a day, 7 days a week. How do you do that, especially if you didn't do it before? Your loved one may possibly not want to eat anymore. Their condition is such that they're not hungry, or they just don't remember, or as in my mother's case, when she became ill, she just took a fork, put it in her food, and said no frequently. So we have to know what we can manage with getting the proper nutrition to our loved one, and if we're able to provide that assistance to get them the meals that they might need. What if your loved one is confused, has some type of dementia, where they become more and more forgetful? Sometimes those situations result in some dangerous situations for the person taking care of them. They could leave the stove on, they could leave water running, they could walk away, and all you did was go in the bathroom and you come out and they walked out the door. I had a dear uncle who lived out in the country, and he managed to get out in a country road before my aunt could find him. And luckily, they lived in a small country area where somebody just came and brought him home, and that was fine. But that happens very often, and it's very frightening for everybody involved. So we want you to think about falls and walking away and those kinds of things that, if you can manage them at home, great. Absolutely wonderful if you can do it. But when it becomes burdensome, when it becomes dangerous situations, that's the time to start really looking at different possibilities. One of the things that worries me the most when I meet with caregivers is the exhaustion that I see. None of us can function without sleep. And I can't tell you whether it's a child or a spouse or a friend, So many people that are trying to do so much are physically and emotionally exhausted with the care. This is the time to really take a step back, listen to your loved ones that are saying to you, you can't continue to do this. I love that you're doing it, but you can't continue to do this. Those messages are great signals to you. They're saying to you, I love you, and you have to take care of you too. If we don't take care of ourselves, we're no good to anyone else. And I'm guessing the person you're taking care of doesn't want that. I can't tell you a number. And I'm guessing Abby would probably have as many of these examples as I would. But one of the frequent things we hear is, I can't do that. I can't think about moving my loved one to a facility because I promised. I made a promise that I wouldn't do it. We would stick together through thick and thin, or mom would never want that, so I could never do that to her. I'm telling you, those promises are made with great love for one another, but you have to reconsider that love as life changes. And sometimes we can't do what we lovingly promised years ago when it becomes exhausting to you. So I'd really like for caregivers to think about the fact that this may be the time, even if you tried a facility and tried respite care, to see whether or not that's something that would work for you so you could really get some rest. So I want you to think about that, because that's a major part of where I'm going now, because many of the rest of the reasons, and one we've already touched on, is the caregiver becomes ill or has an accident. So you're no longer able to provide that care. That's a tough way to go. What happens many times in those situations is we end up in a hospital situation, and as social workers or care coordinators, who's ever working with you, they're calling around and seeing who has a bed now for the type of bed that you need, and you're doing something with maybe even sight unseen for people. Very hard for everyone, including the facility. They want to know you ahead of time as well, whenever that's possible. So just asking you to consider those situations. Many times caregivers are not the person in the home, they're children. They're trying to provide the care for their own children. They're trying to provide care for their parents. They're trying to do maybe full-time jobs. They might have two sets of parents to take care of, lots of different scenarios. Caregivers, as we talked about earlier, could be friends. So really want you to stop and think about what all you have going on in your life, and then balance that with how could you maybe be that person if they were in a facility, because that would be a way to consider whether or not this is the time or not. Frequently we hear caregivers say, I'm so exhausted that I feel resentful. I feel resentful of this person that I love dearly and I want to do this for, and I've loved for many, many years, but it's all about him or it's all about her. And I don't know if I can do this anymore. That is very normal. It's a feeling that we hate, but it's a very normal response to being exhausted. It's a good indicator that it's time for you to look at alternatives, be they alternatives in the home or be they in a facility. So if any of this rings true for you as a caregiver or someone that you love, I just wanted to give you some tips on what we want you to do. Just like anything you plan for, you want to educate yourself about facilities. We all have this image, and it's not usually, I would say, born in what's really going on there. There are, and I think we're very extremely blessed in Iowa, and particularly in our area, to have amazing facilities. When I was working, had amazing people to contact and so helpful in talking to us about what they could do and what they had to offer. So I want you to know the help is there. They want you to come see their facilities. And that's the one thing I really want you to think about. You know, before you go, think about what is the care that you need for this loved one or for yourself, whatever the situation is. Find out your financial situation. Now, that doesn't mean that I don't think you know your financial situation, but you really have to look, you know, if it's a spouse situation, you know, what you need at home, what the care center might need, what maybe the two of you are going to consider if you're thinking about a community setting where maybe you would both go. Lots of things to think about financially, and do some of the math or talk to your financial person, however you make those decisions. If you have long-term care insurance, look at your policy. Talk to the person that sold it to you or to the company. Many times, you know, it's something you bought some years ago, and until you're going into the facility, dust it off and say, what does this mean? These policies have changed over time, depending on when you bought it, what you've updated it with. Really important to have a good understanding of what your long-term care insurance might be. Many people don't have long-term care insurance, and many people don't have great savings. I mean, it's tough to do that today. That is not anything to say, well, I just can't afford this. You need to look at what is the care that's needed, and then, you know, how much can I pay for? Do I need to look at Medicaid, which will help in a long-term care facility, or help with elderly waiver services that might be used in other facility settings? What would your loved one want? You know, we have families that are spread across the country. So many people you'll see when you look at obituaries that, you know, somebody is in Arizona or they're in New York or wherever they might be, because they move to be near a loved one. Is that something you want to consider? And have you had that family talk about, I really want to be close to you when I can't take care of myself anymore? You know, or is your own community? My father-in-law went to assisted living before he passed away, and, you know, he has 6 kids, and everybody would have had him near us. And he said, nope, I love Dubuque. Dubuque's my home, and I'm not leaving here. You know, it was as important to him to be where it was familiar and be near his siblings who lived there. And the rest of us could continue to drive to him. You know, that was how he felt. So it's individual, you know, what is it you want, but really talk with your loved one about that. Talk to your family about that. Maybe look both places and see what you think, because different states have different things. I'm biased. I think Iowa's the best. When you've kind of gathered all this information, that's the time to go look. Go look at the facilities, make an appointment. Now, because we're still in the pandemic, I will tell you that there's some contingencies on that hopefully will be able to go away soon when we get the vaccines out. So it might be something like this. You might have to visit on Zoom to start out with. You might have a limited amount of time you can spend at the facility to look. Those are the kinds of things that the pandemic has brought to us. Non-pandemic, you go in and you look around, you be part of that community for some time. You learn how they contract with you. If you're looking at assisted livings particularly, you have to really understand the different amenities that they offer, because they all do things differently and they all price differently. Long-term care facilities, not as much, but you need to know what is the facility that you need. When you walk into a facility, you have a gut reaction to it. We all do. So going into a variety of them makes you understand, where do I feel most comfortable? Once you've talked with various staff members, once you've talked to some of their residents, you'll get a better feel for how you feel about that. Now, is it always 100%? Are we always right? Maybe not. But by going ahead of time, you have an idea. So if you're not ready for that, or your loved one's not ready for that, in 2 months, 6 months, a year from now, something does happen, that's your great opportunity to say, oh, I went to visit XYZ and that was a nice place, and that's what I think I want to do. The other thing I also suggest you do, if you find XYZ facility that you really think that would be the one, many times they have a waiting list. So if they have a waiting list, put the name in. You can say no and say, nope, not ready. But put your name on a waiting list in case you think it is something that's coming up in the rather near future. I mentioned before respite care. Not all facilities can do respite care in their facility, in their situation. But if they do, something that really want you to consider. And that brings me to my final point. Talk to us at the Family Caregiver Center. Yeah, I don't have all the answers. Maybe Abby does. Maybe Kathy does. No, nobody has all the answers for you and what's in your heart and what you want. But what we can do is help you learn about where the facilities are. We can give you a list of the facilities. We can talk to you about things that, your specific care situation might lend you to, which facilities you look at. Just get you ready for walking into the facilities and looking around. We're all about you, the caregiver, and we want you to feel ready and able to make that decision when and if it's time, and that you feel supported in that by us, as well as those that you're taking care of and those that you love. So in my next Take 10, I'm going to talk about the different levels of care that are available. Facilities do different things. So it's always surprising when you find out I can't even go to that facility because they can't take care of somebody who needs all the care my loved one needs. So we're going to talk about the different types of facilities in another Take 10 about which facility. How do you know the difference between facilities? Sorry. So that's the end of my presentation. Certainly let us know if you have questions or concerns after hearing this. And thank you for watching. And please let us know any of your ideas after hearing this. Thank you.